Hello, so today we based our presentation on Timmy, and Timmy is 12 months old and has been diagnosed with fetal alcohol syndrome. He was born prematurely with weighing only 3.5 pounds. He is not easily consoled, often cries uncontrollably, and does not drink much formula. Timmy lives with his family in the city, and the first year of his life has been very challenging for them all.
Timmy's condition occurred due to alcohol exposure during the mother's pregnancy, which caused brain damage and growth problems. His condition represents and classifies a set of symptoms within fetal alcohol spectrum disorders and is considered to be the most serious and involved type among these disorders. Research shows a prevalence of 0.2 to 1.5 infants out of 1,000 births, 0.3 out of 1,000 children ages 7 to 9, and 6 to 9 out of 1,000 school-aged children. Timmy's mother reported to have consumed an excessive amount of alcohol within the first trimester, where most damage can occur as she was initially unaware of her pregnancy. As alcohol is consumed during pregnancy, it is easily passed through the placenta, where it inhibits adequate amounts of oxygen and nutrients from reaching the fetus's vital organs, resulting in developmental issues. Any amount of consumption is dangerous, but there is a greater risk for the development of this condition if the mother uses alcohol within the first trimester or drinks excessively during pregnancy.
According to the Center for Disease Control and Prevention, in order to be diagnosed with fetal alcohol syndrome, individuals need to present with 3 facial dysmorphia features, aka abnormal facial features. These are a thin upper lip, the eyes appearing to be far apart, and a smooth area between the nose and upper lip. Individuals also present with growth problems in the structural, neurological, and functional areas. In the structural area, individuals present with a small head and a low birth weight. Both of these were present when Timmy was born. A small head is also called microcephaly. In the neurological department, Timmy presents with poor muscle tone and a delay with developmental milestones, and a wide array of functional, cognitive, and intellectual deficits will be seen over the span of his lifetime. When Timmy was born, people knew right away he was different from other babies. He was born prematurely and had an extremely low birth weight. The first year of life has been very difficult for Timmy and his family. Feeding him is never an easy task, and it often results in gas, pain, and fussiness, which means he doesn't drink a lot of milk at a time, and this has resulted in him growing really slowly, and he has poor muscle tone and coordination. Timmy is behind on developmental milestones, and at 1 year of age, he's not producing any baby talk or babbling, and he sits up on his own, but he doesn't crawl or walk. And crawling is usually around 7 months of age, 8 months, and walking are right around a year old. So he's definitely behind in that area. He has an increased startled reflex and increased irritability. He doesn't want to be held or touched, and he often avoids eye contact. And he sleeps very poorly throughout the night and doesn't have a routine nap schedule.
Principles of medical and educational management. While there is no cure for fetal alcohol syndrome for Timmy and other children, there are early intervention services available to reduce some of the effects. These services are provided by occupational therapists, physical therapists, and psychologists to address Timmy's walking and talking. As Timmy grows up, he can also be provided with services by special education teachers and speech therapists. Some of these services will then address the social skills and potential behavioral issues that Timmy may have. Another service that could be provided to Timmy would be by his doctor, who would address potential vision problems and heart abnormalities. There are no medications to treat fetal alcohol syndrome, but medications can be prescribed for the symptoms. Some of these include stimulants, antidepressants, neuroleptics, and anti-anxiety drugs. Some of the side effects of these medications include dizziness, fatigue, nausea, and sleep problems. Because Timmy is only 12 months old, he may not be prescribed with these medications at this time. However, he may be prescribed with these as he grows older. Another service that is available to Timmy and his family could be counseling and therapy.
With alcohol, the symptoms persist well into the first few years of life. Timmy's condition developmental aspects make it difficult to raise him. For the first few years of his life, he would constantly cry throughout the night. A typical child can be rocked or cuddled back to sleep, but Timmy cannot because he is sensitive to external stimuli. He does not want to be touched. Per therapist's recommendation, his parents reorganized his room so there is minimal sunlight and as quiet as possible. This has helped to decrease his crying. In addition to crying, Timmy is undersized for his age. He has an increased startle reflex, which causes him to vomit and makes it difficult to drink from a bottle. It causes gas and pain. This excessive crying, lack of sleep, and poor eating habits have made it difficult to maintain a stable weight. Because of Timmy's physical abnormalities, he frequently visits the doctor. It is quite common for him to get an ear infection or allergies. From first-hand experience and the medical team's recommendation, the family is slowly adapting to his occupational performance. The goal is to create an environment where everything is calm and quiet. His family avoids taking him out to the mall or other social settings. Timmy does not attend childcare and has minimal social participation with friends and family.
For Timmy, the most common setting would be home-based. The OT's role would implement early intervention services and focus on treatments including parent, caregiver support, medication, and/or adaptive skills training for him. Going from a home base to a preschool would create a major shift for his and his family's lifestyle. As mentioned previously, Timmy lacks the social skills, which is crucial in a preschool setting. An OT would focus on special education preschool and specific strategies such as memory aids, routines, different teaching methods in order to help Timmy succeed.